Hello folks, welcome back. This is Kweku. I'm a pharmacist. This channel is dedicated to healthcare information as well as pharmacy stuff. So feel free to hit the subscribe button if this is something that you find interesting or useful. Today we'll be reviewing the medication Meloxicam. As usual, we'll be taking a look at a brief description of the medication. We will take a look at some of its approved uses, some common doses, as well as some best practices or precautions. We would obviously take a look at some side effects as well. And as in all my videos, please use this one for informational purposes only. Do not substitute information provided in this video for medical advice which has been given to you by your primary care physician. So Meloxicam, which is sold under the brand name Mobic, belongs to a class of medications called NSAIDs, which is non-steroidal anti-inflammatory drugs. They are primarily used to take care of pain and inflammation or swelling. And common in this class are ibuprofen, naproxen, diclofenac, the famous aspirin, as well as indomethacin, and a host of others. Approved uses include osteoarthritis, rheumatoid arthritis, or juvenile rheumatoid arthritis, which is basically inflammation in the joints of children. It can also be used for moderate to severe pain, either alone as a single therapy or monotherapy, or in combination with other pain medications which are not NSAIDs. Typically, you don't want to be using two NSAIDs concurrently, and we will get into that when we talk about the precautions. A typical dose is 7.5 milligrams daily, which can be increased up to 15 milligrams daily. So the maximum recommended dose is 15 milligrams daily. I must say, however, that I have seen some doctors prescribe more than that. I've seen 30 milligrams a day. But just bear in mind that the maximum recommended dose is 15 milligrams. So if you are one of those who've been prescribed 30 milligrams, it depends on your individual circumstances. And the best way forward is to have a discussion with your doctor. Now, some side effects. Side effects primarily center around gastrointestinal issues. So there's been reports of gastrointestinal bleeding, gastrointestinal ulceration or perforation. And typically, the longer you stay on this medication, the greater the risks of such gastrointestinal side effects. And I must say that it is not unique to Meloxicam. It is generally a side effect of all the NSAIDs. So you see from the statistics here, about 1% of the patients treated for 3 to 6 months had some form of gastrointestinal issues, while if you increase that duration to about a year, that percentage doubles or even almost quadruples to the number of people that experienced such gastrointestinal bleeding or ulceration. Other side effects include abdominal pain, occurring in about 1.9% to 4.7%. There's been reports of diarrhea, flatulence, nausea, occurring in about 3.3% to 7.2%. Other reported side effects include vomiting, anemia, fluid retention or edema. There's also been reports of some allergic or respiratory reactions. So sometimes NSAIDs in general or Meloxicam can trigger some asthma symptoms or some bronchospasms. There's also been even reports of itching. Dizziness has also been reported. To be honest with you, if you look up side effects of NSAIDs, you're going to see such a long list that it may scare you. But practically, a lot of people actually take NSAIDs or Meloxicam for that matter, and they do quite well on it, as long as you take into consideration some of the precautions that I'm about to share. Now, the first one that we will tackle obviously deals with gastrointestinal side effects. And one of the easiest way to handle that is firstly to take Meloxicam on a full stomach. Do not take Meloxicam on an empty stomach. While having food in the stomach may not necessarily eliminate these risks, it reduces it significantly. So don't forget to take Meloxicam. With something small in the stomach, some crackers, just don't take it on an empty stomach. Also, it's a very good idea to avoid taking other NSAIDs concurrently with Meloxicam. So the expectation is that you will not be taking, say, Meloxicam and naproxen. If there be any reason why you need anything extra, generally it's recommended that you do something that is non-NSAID, something like maybe a Tylenol, as long as it is approved by your doctor or you don't have any other reasons why you cannot take something like that. So for this reason, anybody that actually has a history of stomach ulcers or stomach bleeding, generally we recommend that you be very cautious if you have to take Meloxicam or if you have to take any NSAID for that matter. So definitely make sure to let your provider know, whoever is prescribing Meloxicam, that you have a history of stomach ulcers. Also, if there is a history of hypertension, you want to be cautious when you take Meloxicam. This is because generally long-term use of Meloxicam or NSAIDs may lead to worsening hypertension, and that making the individual more prone to risk of cardiovascular incidents. So generally speaking, if you're taking Meloxicam and you have high blood pressure, you need to be monitored to make sure that everything is on the right track. Your blood pressure is not, doing anything crazy. Also, if anybody has any bleeding disorders, they need to be careful when they take Meloxicam. This is also true for people that don't necessarily have bleeding disorders, but take maybe blood thinners, maybe something like a warfarin or antiplatelet medications. And some antiplatelet medications may not necessarily be called so, but they may have those functions. Typical examples that I can think of are some of the antidepressants like Zoloft, Paxil, duloxetine. Some of these have antiplatelet activity, and therefore when combined with Meloxicam, they increase the risks of bleeding. So concurrent use of Meloxicam in this class of medications should also be taken into consideration. Precautions should be taken when you take such a combo. Don't get me wrong though, I'm not saying that they are contraindicated and you can never take those two together, but just a precaution, so you know what to expect. People with a history of kidney disease should also be cautious when they take Meloxicam. Meloxicam and other NSAIDs have been known to cause a worsening of kidney function, and therefore, if you're already having issues, you may need to reconsider. So while generally Meloxicam is relatively safe to use, in certain classes of people, the risk of adverse effects is relatively higher, and such people should be cautious. We're talking about older people. We're talking about people that smoke, people that use excessive alcohol. Those classes of people are generally at a higher risk of developing adverse effects. So if you fall into that category, you may need to make some amends. So some general best practices: make sure to take Meloxicam at the same time every day. And this medication, Meloxicam, actually may cause a delay in ovulation for women and also may decrease sperm count in men. So if you plan on having children, definitely discuss this with a doctor before starting on Meloxicam. Also, let your doctor know if you develop any kind of rash, any kind of blistering or peeling of the skin. This may be a sign of a serious allergic reaction that needs to be taken care of. Thank you so much for staying with me through this review. As usual, I appreciate your support. If you haven't already subscribed, please do so, and I'll see you on the next one.